Have you been hearing a lot about the pelvic floor? I'm Dr. Chantelle with MyoLab. Let's talk about it. One of the reasons we care a lot about the pelvic floor is that it's a part of the core. When we're talking about the core, we're talking about the full cylinder that helps pressurize and stabilize our low back. So we're talking about our diaphragm on the top, our pelvic floor on the bottom, and then our abdominals and obliques across the front, and our deep low back muscles around the back. That all works together to function as a pressurized stabilization around the low back. It helps take some of the pressure off the spine itself. In order for that to happen, we need to make sure that our diaphragm and our pelvic floor are working in conjunction with each other. So let's go through a couple of breathing exercises to help you see what that feels like. Now, when we're lying on our back, we are not fighting against gravity, and so that really helps with this exercise. Most people are pretty good at the belly breath, the really anteriorly moving stomach, the chest stays nice and relaxed, and we get that sort of translation through here. What most people don't do a lot is like a full diaphragmatic 360-degree breath that involves the pelvic floor. So we're going to go through that a little bit. With this, what you want to be feeling as you breathe in is that everything in this area expands and presses out. So our stomach moves up, our sides come out, and our low back presses down against the ground when we breathe in, drawing air into our lungs. What that's doing is actually taking our diaphragm from a nice curved position, and it flattens it out as we breathe in. That will help actually recruit and activate the pelvic floor, which is supposed to mimic that same motion of moving from a curved, domed space into a flattened space. Now, for the diaphragm, when we breathe in, it actually is contracting to lower. For the pelvic floor, it actually relaxes as we breathe in. So that's really what you want to feel, is that as you breathe in, you're drawing air in and down towards your pelvis, feeling that pelvic floor relax, and then exhale, and it comes back out. This is a really good exercise to just hang out and breathe for a few minutes. It activates our parasympathetic nervous system, helping us relax. So that means it's really great to do right before bed. So you're just going to hang out here and breathe. With this, you want to focus on a really slow exhale because that's going to help everything relax. Thanks for watching.